3 and then we'll do the question number 2. A gynecologist is approached by a close friend of her after the church service. They gather together. Mark and I were going on a vacation next week. I totally did not see this coming, but I'm going to run out on my birth control pill. I'm afraid I won't be able to get new prescription filled before we leave because next few days will be very busy. I know this is awkward, but could you please write me a prescription just to cover the time I'm back from the vacation. Physician has also known a friend for many years. She cannot. She knows that she has no personal history of serious illness. Friend is also attorney who is having hectic schedule, which patient sympathize with. Which of the following is most appropriate action from the physician? So what should we do in this situation? Like someone at a party approaches you, someone at church service, sorry, approaches you for the taking some medication. What should we do? Should we give them? Should we tell them to come back later? Yes, we should not give the patient, and we should explain them it's inappropriate to prescribe any medication to friend unless that's an emergency. Okay, so AMA, American Medical Association, they released a guideline that a physician should not be involved in the care of a friend or anyone from the family because it can create an emotional attachability with the patient, and that can have effect on decision making. So we cannot suggest them to use condom because patient is on birth control pill, and this would be very unethical. Inform the patient it would be never appropriate for the physician to involve in the treatment. As this statement is incorrect, physician can involve in the treatment of friends or family member if that's an emergency, but other times it's generally not recommended, but it's not illegal. It's never appropriate. That is not the right response. Prescribe any options with prescribing the medication should be ruled out. So here you can see AMA codes of ethics, the self-treatment and treatment of immediate family and treatment of close family only can occur in emergency situation. So emotional relationship can interfere with physician objective judgment. Okay. And the relationship can cause physician or patient be uncomfortable obtaining the full history and physical examination like sexual history or genitourinary history. So it's not appropriate to provide treatment to the friend in non-emergency situation. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.